U.S. health spending is now twice others countries and with worse results. The U.S., according to this latest study that was published in the Journal of the American Medical Association, the U.S. spends about twice what other high-income nations do on health care, but has the lowest life expectancy and the highest infant mortality rates. More doctor visits and hospital stays aren't the problem. They say that Americans use roughly the same amount of health services as people in other affluent nations. Instead, the health spending may be higher in the U.S. because prices are steeper for drugs, medical devices, physician and nurses' salaries, and administrative costs to process medical claims. They say there's no doubt that administrative complexity and higher drug prices both matter, as do higher prices for pretty much everything. To talk about it, it is the president and co-founder of GDP Advisors. He's a health insurance strategist. Seth Denson joins us on the wake-up call this morning. Good morning, Seth.
Hey, good morning. Thanks for having me on.
So as a health insurance strategist, a lot of people point at the health insurance agency and they say, well, there's about 80% of the problem. What do you say?
Well, I would sadly agree with most of them that make that statement. The insurance industry has not been a friend to the consumer and how they operate. Listen, I used to refer to the healthcare system as a three-legged stool with providers, payers, which is the insurance industry, and then the consumers, you and me, right? Well, I now consider it a three-headed cannibalistic dragon because it continuously feeds off of itself, and it tries to keep the consumer in the dark because the more that you and I are in the dark, the more they can control the delivery system and manage it more effectively. And health insurance is just healthcare financing. That's really all it is. So as healthcare expenditures rise, health insurance companies can charge more, thus their margin of profit continues to go up.
I guess the next question is, okay, so if that's the case, what do you do about it?
Yeah, so this is where we live in this constant state of what we consider to be capitalism and care. This internal conflict, right? Because the free market system in the U.S., which is responsible for the vast majority of innovation and research and development in the healthcare space, also utilizes the American taxpayer to foot the bill for that research, development, and innovation. And most of these other foreign countries have higher levels of government control, which regulate the overall cost structure. So that's why we're seeing other countries have a lower cost point than here in the United States. The challenge with that is, how do you not infuse government intervention in the capitalism and free market spectrum, but also create an even playing field. And one of the key drivers, I think, of this, and this is where the government could step in without getting too intrusive into the free market system, is by regulating how these healthcare delivery markets do business. For example, right now in the United States, the markets operate under what's called a fee-for-service model. In other words, I can charge for what I do, not based on the overall outcomes. And so a recent study in the state of Washington, near where you guys are, showed that there's roughly 21% of all services, that was almost $300 million just last year alone, was waste. It wasn't even necessary. And that's because the model supports these tests and unnecessary services to generate a higher level of profit.
Okay, so what you're saying is, because we've always heard, they go through, they do all of these tests because they're trying to cover all the bases because they don't want to get sued. What you're telling me is, and what I'm hearing you say is, the reason for all of these tests is that they're doing this simply because of the fact that they want to create profits for themselves.
No doubt nobody wants to get sued, right? But at the same time, you're right. It is about the profit drivers. Listen, I've never seen more private equity money getting into healthcare than I have at any point in history than right now. The reason is, a recent study showed that the return on investment in healthcare is 8-to-1. So if I am a Wall Street guy looking to invest money, I'm going to invest in the healthcare system. That's the quickest and fastest return. There's very little transparency. It's not regulated, so I don't have to show you what I'm charging you until after those services are rendered, and I'm using the health insurance mechanism as kind of my barrier to hide those costs to the consumer.
You brought up a really interesting point here. You talked about a lack of transparency. And, we keep going back and forth about, it's the free markets, it's capitalism, and all of that. But yet, really, it's not when you consider that in many areas, and I happen to live in one of them, where it is just one single healthcare provider for 3 different cities providing the services. And if you are a medical doctor and you are not a part of that system, well, guess what? You don't get access to the hospital.
That's actually, you're absolutely right. The healthcare system is wrought with this structure of control that is really few conglomerates control the majority of the movement within the healthcare system. I mean, we're also looking at prescription drugs. 85% of all drugs filled in the United States are done so through one of 3 distributors, all of which are now owned by insurance companies. So we want to start to look at the overall structure by how healthcare delivery systems are delivering care to us. We need to follow the money trail all the way to the top, and what we will find is this largest portion of the U.S. single portion of the U.S. economy is controlled by a very small portion of entities.
Let's talk about this idea of, like, for instance, Samaritan Health Services, Providence, etc. They call themselves nonprofits. Are they?
Many of them really are nonprofits. There's a lot of these Christian care organizations and things like that, which are effectively doing what originally insurance was set out to do. The first true employer-sponsored health insurance policy was established in my home state of Texas, where it was a number of nurses that came together and pooled their money to help any other one of the nurses that ends up having a medical expense. And so that's what a lot of these organizations do. Now, they're popping up a lot, so keeping up with the ones that are doing good and those that are not is hard to do. But the basis by which many of these medical share organizations are established is actually a good one, and it was originally how health insurance was financed.
Okay, but we say that it was good, and yet they have a lack of transparency, and they're still charging inordinate amounts of money to go in and get simple procedures, be they x-rays, be they CT scans, whatever. They're still using the same model of, just test after test after test after test after test. It's really hard to believe that even though they call themselves a nonprofit, that they're not just as big a part of the problem.
Yeah, you always have to look behind the curtain, right? I mean, Blue Cross throughout the country is a perfect example of this. In most states, they're considered nonprofit, but they're managed by a very for-profit organization, and so the devil's always in the details of these organizations. Listen, there is a significant lack of true competition in the marketplace right now from the delivery standpoint, and until we get to a place where the delivery system is held to a higher standard of transparency on how they charge their services so that you and I can understand that, until we get to a place where there's some form of national registry of charges, again, if you want to be a hospital that charges whatever you want, that's one thing, but you need to be required to disclose that beforehand so that people can understand what they're getting into. And that would also allow for more competition, I think, to step into the marketplace to say, hey, we'll compete with those prices. I think we can deliver this at a lower cost. And until we get to that point, I fear that the cost will continue to rise.
Well, and you say, that they be required to do that. That would require legislative action. And you know as well as I do that between the pharmaceutical companies, the medical industry, the insurance companies, they have a quite a bit larger lobbying force and ability to donate to elections than your average person who's going in because they have diabetes.
No question. I mean, listen, the healthcare lobby is massive and significant, and the healthcare lobby consists beyond just the healthcare delivery system, but it consists of insurance companies and pharmaceutical companies and all the like. So, unfortunately, until we get a Congress that's willing to do more than just provide talking points and actually get engaged in solutions, I fear that we're going to continue to see the rise of healthcare costs and the increased profits of the healthcare systems.
All right. Seth, thanks for joining us on the Wake Up Call this morning.
Thanks for having me on.
All right. Seth Denson, he's a health insurance strategist, founder, and president of GDP Advisors, on the Wake Up Call this morning, where KPNW News Time is 6:53.
We're fortunate to have a special guest with us this morning, president and co-founder of GDP Advisors, a health insurance strategist. Seth Denson is with us. Seth, welcome. Good morning.
Hey, good morning. Thanks for having me on.
Hope you're doing well. We spend a lot of our time trying to understand the issues of the day, two that are incredibly confusing to me. And my business life and political life have been the enormous increase in prices in relation to student debt, the cost of higher education, and health care. Health care consumes an ever-growing part of our GDP and budget. Seth, I'll give a story, and I'd love to hear your commentary as to how you think we've ended up here and what you think we need to do reactionary accordingly. I got to the point in my life that I didn't see as well as I did in days gone by. I went to the eye doctor, was fitted for contacts. The insurance did not pay for that. So I'm walking up to the counter where I'm to, pay my bill, whatever that bill may be. And Seth, I have no idea if this lady is going to say $300 or $3,000. And for the life of me, I don't understand how we believe that's a sustainable, practical model of which to transact any sort of business, especially a business like health care that consumes such a large part of our GDP. How did we get here? How did healthcare become so confusing and consume so much of American economy?
Yeah, listen, this is what I oftentimes refer to as the conflict between capitalism and care, right? I mean, I'm a big fan of our economic structure here in the United States. I'm a capitalist myself. But unfortunately, the way that the healthcare system is structured, it's structured so that you don't know what you're going to spend or need to spend until after you've had those services rendered. And that's in large part because there's very little transparency in the system itself. As you mentioned earlier, healthcare consumes a huge chunk of our gross domestic product here in the United States, and it is the fastest growing sector in all of the economy. And so when you look at that and you look at the way that the system itself is extremely non-transparent, it leaves you and I as the consumer left really in a dark and bad place when trying to identify the overall cost that we're going to associate that care with. And then I will also say that there's no consistency of the pricing of care. I mean, I'll take MRIs, for example. I can go to one facility and get an MRI, and literally across the street you'll get the same level of MRI and spend 400% more. So there's no consistency or structure in the healthcare system right now, and that's in large part due to the lack of transparency.
Seth, a large part of the conversation is had about the healthcare premium. What is my insurance premium? We've got Obamacare subsidies. We've got a gold plan and a silver plan and a bronze plan. Why are we not paying close attention to the cost of the health care provided? The debate seems to be more insurance-centric. What am I paying per month for my health care in relation to what does an MRI cost? What does a blood transfusion cost? How did we get those confused? Because to me, our priority should be what is the cost of services as opposed to the monthly health insurance premium?
You have hit the nail on the head, my friend, and what we need to do is get more of people in Washington to listen to your radio program, because for the life of me, I can't understand how, specifically to the Affordable Care Act, which solely addressed the healthcare delivery system from a financing mechanism. And listen, health insurance is just healthcare financing. You said it absolutely right. And so if we're not focused on the delivery system itself, on the actual cost of healthcare, we're never going to see the cost of health insurance premiums go down. Because if I'm an insurance company, and they're run by very smart business people, and I'm taking what my costs are, all I'm doing is adding finance charges and profit margin, and I'm effectively spinning that back to you as health insurance premiums over time. And so until we start to address the overall cost of health care, the cost of health insurance will continue to go up. And Washington just doesn't seem to get that.
But, Seth, isn't that because, Donald Trump ran on the campaign slogan to make America great again and drain the swamp? I'm not pointing fingers at people. I have a political past. I've dealt with lobbyists. I've dealt with consultants. I've dealt with prevailing forces in the American political dynamic. How much of this lies at the feet of Washington? How much of this has Washington allowed to permeate the healthcare system in America?
A big chunk of it has to lie on the feet of Washington. But listen, I'm also a big proponent of self-identification of blame as well. And we as consumers here in the United States do a terrible job of consuming health care. The average American spends twice the amount of time researching a television they're going to buy than they do researching the prescription that their doctor prescribes them. When it comes to healthcare, we just decide as a society that we're just going to get dumb or not look for more information or ask better questions. And so we own some of that blame. Unfortunately, I think in Washington you do have a lobby situation going on, but you also have a lack of understanding. And one thing that I've learned a lot of times in my engagement with certain politicians is they don't want to ever look like they don't have the answers, and so they don't ask the questions the right way either.
Seth, there's a humanitarian issue. I'm right of center. I wouldn't call myself a right-wing conservative. I'm more of a pragmatist when it comes to my view on American politics. But I do believe one of the failings of Obamacare and one of the failings of anything we've utilized to address health care in America recently, it's the only form of insurance that we're not asked to have skin in the game. In other words, I'm not rewarded for making conscientious decision, and I'm not penalized for being irresponsible. My life insurance, my car insurance, my home insurance are all based on some merit system of which I am accounted for properly. Is there any hope we would ever get to a place in our healthcare system and model in America where people who take care of themselves are rewarded for that and people who don't are penalized?
I would hope so from a standpoint of those things that which we can control, right? The insurance model and the financing model of healthcare should be based on the things that we voluntarily or voluntarily do to ourselves, not those things that we involuntarily do, right? Certain diseases and things that we can't control, I'm not a fan of those things causing me to be penalized. But I'll tell you, the way that the healthcare system is structured as well is it rewards the provider system for the amount of tests and services they render. We need to eliminate here in the United States the fee-for-service model that currently is driving up the cost of delivery system. Providers are rewarded for the number of services they perform, not for the outcomes of those services.
You and I share similar opinions in regards to that, but I don't see any energy nor effort of the power brokers in this debate going there. Is there any hope whatsoever? And then I've got one last question. Is there any hope whatsoever that we could get to a place that you and I are talking about? And if so, what can the public, what can the people listening to the show conscientiously be involved in advancing?
That's right. So I'm hopeful that there's hope, right? I'm gonna double it up there. Unfortunately, from what we're seeing out of Washington, until the train completely comes off the tracks, my fear is that we won't see a lot of change. But that's at a macro level. What I would tell your listeners is, from a micro level, everything starts with us, right? Let's be better consumers. Let's try to understand the system. Let's make sure that we have a voice in this, and I think that's the best place to start.
Last question. There is a belief amongst pragmatists such as myself that the only answer is to allow for some sort of single-payer system, to indeed allow the government, is contradictory to my personal philosophical beliefs about the market, but we've gone so far down this road of the government manipulating health care and having its agenda in contrast with, what the free market stands for and dictates. What is your opinion of some modified version of universal or single-payer health care?
Yeah, so I'm very rarely a fan of the government getting involved in the business side of things. Government has proved time and again it's a bad business person, right? And so what I'd like to see is higher levels of government regulation without getting into the business side of price fixing and structure. For example, the government regulates how we drive down the road, what speeds we're allowed to go. The government can do the same thing in healthcare and regulate how the delivery system works, regulate transparency and an open concept of identification and changing the model by which providers are compensated for their work. These are the things that the government can do, and I think that if we do those things, we would start to see the costs go down, and we wouldn't have to get into a system of regulating care from a standpoint of a single payer system. Those models throughout the world look to the United States for innovation and advancement because of our capitalistic society and our ability to choose the health care that we consume.
Very well explained. Seth, thank you for your time this morning. Have a good day.
Thanks for having me on.
All right, the U.S. spends about twice what other high-income nations do on health care, but has the lowest life expectancy and the highest infant mortality rates? That's a little shocking. More doctor visits and hospital stays are not the problem. Americans use roughly the same amount of health services as people in other affluent nations, the study found. Instead, health spending may be higher in the U.S. because prices are steeper for drugs, medical devices, physician and nurse salaries, and administrative costs. Seth Denson, president and co-founder of GDP Advisors, health insurance strategist. Seth Denson, well, is it because it's just more expensive, Seth? I mean, we can't be bad at it. We're good at health care.
Hey, good morning, Stevie. Thanks for having me on. Listen, the United States is actually responsible for most of the research and development and advancement of healthcare throughout the world. The challenge is this is what I oftentimes refer to as the conflict between capitalism and care. I'm a capitalist, so let's just put that out there on the front end. I believe that we have the greatest economic free market system in the world. That said, sometimes when you infuse this without any boundaries in something like health care, you do get this situation where we as Americans are spending so much more than the rest of the developed world, but getting similar or even in some cases worse results.
Well, what do we do, Seth?
Well, this is the hard part, right? I think there is a macro and a micro solution here. I think that let's start with the micro. First and foremost, you and I could be better consumers, right? The American public could spend more time understanding the healthcare system and doing right by the healthcare system by doing right by themselves. And what I mean by that is, the average American spends twice the amount of time researching a television than they do the cost and the drugs that their doctors prescribe. And so, there is a lot that we could do as consumers. From a regulatory standpoint, from a macro solution, while I'm never a fan of the government getting involved in the healthcare system, I think that would dwarf advancement and dwarf the free market structure. What the government can and should do is put some speed limits on this thing and put some regulatory boundaries around how healthcare is delivered. Here in the United States, we operate under what we call the fee-for-service model. And what that means is that providers and hospitals are rewarded based on the number of tests and services they provide rather than the overall outcomes of those services.
Well, and again, as far as getting coverage, we were priced out of it as my family. We were going to pay, I think, $2,500 a month. It was just too much. So I went to a Christian health share, but then they only pay whatever the Medicare list thing is, and I'm responsible for the rest of that. So I'm beginning to believe I can pay $2,500 a month, or I can pay $800 a month, $600 a month, whatever I do, and I'm going to pay anyway because they're not going to cover what the charges are. I'm not sure if it's not 6 of one, half dozen of another at the end of the day.
You're absolutely right. And the biggest challenge that most Americans don't understand is that health insurance premiums are just a derivative of the overall health care costs. It's just the financing mechanism. And so, and listen, one of the big issues you just hit the nail on the head was the fact that the Medicare system, so the system that the government uses to procure health care for members of that system, is roughly 200 to 300% less expensive than what you and I as private payers pay.
Well, and so the chart's bad. The chart isn't paying what it costs. So it's just it's a percentage of what the care actually costs.
Well, that's right. But the question that I would say is, what does the care actually cost? You know, I can go to an MRI here in Dallas where I live in two different places and spend a 400% variance between those two places. So at some point we have to have a real conversation about the true cost of the delivery of health care. Yeah.
I mean, it's very frustrating and it's very confusing. And yet I'm not sure. I don't know how it's. All I want is a concierge doctor like I have, and I can call her cell phone. And then I want a massive $10,000 umbrella. That's all I want. And I don't know how to get that.
That's right.
That's all I want.
Yeah, and unfortunately it's not available right now.
Yeah, I know. Is that going to go with the tax plan, the cuts and everything? Is that included for 2019? Or I can go get a big umbrella?
Very little was put into the current omnibus budget bill surrounding health care, unfortunately.
I thought the tax cuts included a new change for Obamacare where I can get a big umbrella and the law will allow that next year.
There's some various aspects in there, but listen, the devil's always in the details, and unfortunately what the tax bill did not do is really restrain some of the aspects of the Affordable Care Act, which are still very much in place.
Yeah. Bottom line, Seth, don't get sick. That's your plan there. Seth Denson, how do people find you at GDP Advisors?
GDPadvisors.com is the best way to find us.
Always a pleasure. I always appreciate your knowledge and insight. Thanks so much, Seth.
Stevie, appreciate it.
You bet. 743.
Coco News Time, 612.
The U.S. spends about twice what other high-income nations do on health care, but has the lowest life expectancy and the highest infant mortality rates.
That is hard to believe. Health insurance strategist Seth Denson is joining us here on the Coco News Live Line. And Seth, we aren't actually going to the doctor more often or spending more time in the hospital. What's the primary driver of our health care costs then?
Hey, good morning. Thanks for having me on. You know, listen, the primary driver of cost is that the United States subsidizes healthcare advancement for the rest of the developed world. I mean, the United States spends more, but it develops more. So I think there is a positive there. That said, you know, most of these other countries that were studied in this research project have heavy government control and management of healthcare in those areas. So while the free market system here in the U.S. is great, unfortunately the federal government doesn't put a lot of boundaries on the capitalistic structure of the delivery system. And this is where I oftentimes talk about the conflict between capitalism and care when it comes to healthcare.
Okay, here's an idea. What if we just went back to paying a doctor for a visit and cutting out the health insurance?
Not a bad idea. I like where your head's at. I mean, listen, health insurance is just healthcare financing. That's all it really is. And the problem with the healthcare delivery system is that it's massively complex. A recent study of Duke University Hospital showed that there are effectively one billing clerk per bed in the hospital. And that's part of the driving of cost. And so, you know, when we think about the standard networks that are available in the insurance marketplace, you know, you got Aetna and United Healthcare and Blue Cross and Kaiser and all these different networks. The hurdle is, I'm not talking about 4 or 5 different networks. There are actually multiple layers within those networks, and it's massively complex. And so the hurdle is the administrative side of the delivery system, in addition just to the overall run-amok structure by which healthcare delivery systems charge a wide array of charges for effectively the same service with no real rhyme or reason as to why.
You know, one of the things, so I had a long-time doctor here in San Diego, and she actually quit once all of these healthcare reporting rules went into effect because she couldn't write down, you know, I had a file like 5 inches thick. She was my doctor for 20 years. And suddenly she was having to do it on the computer, and I saw her back more than I saw her face. And she actually quit medicine and said, I'm not doing this because I'm not being a doctor. I'm a data entry clerk.
That's exactly right. And what we're seeing right now is, unfortunately, a future shortage in primary care doctors. More and more people that are getting into medicine are getting into specialties, not primary care generalists. Because, to your point, the ICD-10 coding system that we use here in the United States, while advantageous from understanding cost drivers, it is extremely complex. And most doctors get into that business to treat patients. And unfortunately, they're left to become more business-oriented people than they are healthcare delivery folks. And that's a big problem that we have looming here in the United States.
Is there anything Washington can do to avoid a complete healthcare derailment?
Or will do.
Yeah.
Well, I think the latter part of that will do is the big driver, right? I think they may be forced to do it over the next few years if we don't step up and do it now. But unfortunately, Washington seems more interested on winning the conversation than they do on actually impacting change. There's a couple things that the government could do, but the biggest driver would be putting some boundaries on how healthcare delivery systems work. For example, right now we use a fee-for-service model here in the U.S., and what I mean by that is that providers and delivery systems are rewarded based on the number of services rendered rather than the outcomes of those services in general. And there's zero transparency regulated here in the United States. I mean, we regulate a lot of things. If I go buy a box of cereal, I know exactly how many calories are in it, right? But we don't regulate what hospitals charge, and I'm not for regulating that, but I am for regulating how they charge it and being transparent in how they charge it. So I know when I go in what things are going to cost me. That'll allow me to be a better consumer and make decisions on where I go to seek care.
Seth, thank you very much for your time.
Thanks for having me on. Appreciate
All right. That is health insurance strategist Seth Denson joining us on the Kogo News Live line.
There's a new study out there that says U.S. health spending is twice as much as other countries, and it has worse results. Joining us in the WMT Morning Show is Seth Denison. He is a health insurance strategist, president and co-founder of GTP Advisors. Seth, good morning. Welcome to the program. How's your Tuesday?
Hey, good morning. Thanks for having me on. Beautiful Tuesday down here in Texas.
Glad to have you on the program. Now, explain this study. It didn't encompass all the countries, but it encompassed maybe a couple handfuls.
Yeah, it encompassed those countries that we would probably associate with high levels of health care, United Kingdom, Australia, Netherlands, Norway, Switzerland, Canada, France. There were roughly 11 countries done in this study, and U.S. unfortunately ranked 11 out of those 11 countries.
Interesting. So we're comparing ourselves, and that's fine. We can compare ourselves to these other countries. But you're saying not only did we get worse results, but we spent twice as much as these countries. How did we get to this position?
Yeah, I think there's a couple of things. And while the results in some of the various categories that they studied weren't quite as bad as some of the others, they were still on the bottom tier. I think the biggest driver of this is the cost, and this is what we oftentimes refer to as the conflict between capitalism and care.
Right.
Those 11 countries that I just mentioned have high levels of government regulation and control in the healthcare delivery system. And so here in the United States, we have a wonderful capitalistic society, but unfortunately, some of the, we'll call them potential downfalls of that or impacts from a negative perspective, is that when you infuse the capitalism side and the healthcare delivery side, you are going to see a higher overall cost structure. And oftentimes, even when the results are the same as other countries, the cost associated with those results can be quite higher.
Interesting. So we've got these that are higher, and Washington is doing what about this? I don't see a whole lot of action to repeal anything. In fact, they continue to move stuff forward from the Affordable Care Act.
Very little that they're doing right now, unfortunately, and what we see as a huge problem with what's coming out of Washington is that, quite frankly, they're just not looking in the right areas. I mean, the Affordable Care Act is a great example. While there were some parts in the Affordable Care Act that I could understand, things like removal of pre-existing conditions and things like that I think we could all get on board with. The problem with the Affordable Care Act was it was all health insurance reform, not health care reform. Mm-hmm. And what most Americans don't realize and understand is that health insurance is just the financing mechanism of the healthcare system itself. So if you're not reforming the overall cost of the delivery of health care, health insurance premiums, which is the financing mechanism, is just going to continue to rise.
Now, that makes complete sense. See, that's why you're a professional in this. Health insurance strategist Seth Denison joining us from Texas here on the WMT Morning Show. Seth, thanks for your insight. Appreciate it, and hope you have a good Tuesday, all right?
Thanks for having me on, guys.
All right, take care.